Hi everybody, I'm Dr. Joe Nemeth. I'm a periodontist in Southfield, Michigan, and today I want to talk about how to save your teeth, particularly with flossing alternatives. If you want to save your teeth, probably the most important thing you can do is to eliminate the bacteria that cause gum disease, because that's why most people lose their teeth, because of gum disease. And gum disease almost always starts between the teeth in small pockets that develop in those areas. If you can keep those areas clean and free of bacteria, chances are you're going to prevent gum disease and you're going to save your teeth. So let's talk about some of the alternatives to floss and some of them that I use personally. This is a Sulcabrush. It's got a very small tip and it works very meticulously around the necks of the teeth and a little bit between the teeth. So this is one possibility. The way this would work would be one would very carefully clean around the necks of the teeth and work it in between the teeth to stimulate the tissue between the teeth and clean under the gums there as thoroughly as you can. And you do that on the outside, and don't forget the inside. It's very important as well. One end is specifically for the inside. The other end is specifically for the outside. Makes it even easier for you to use. Next, we have another version of the Sulcabrush by Sunstar. This has just one end, but again, it's small. I like the handle because it's got a rubberized grip that makes it perhaps a little bit easier to use. And again, used on the outside, work it between the teeth. Used on the inside, work it between the teeth. Can be very valuable. So we've talked about some of the brushes that can help as an alternative to flossing. Now let's talk about some of the instruments that fit really between the teeth for cleaning very thoroughly instead of floss, or in addition to floss, between the teeth. This one, number one, is the gum Proxybrush, and this is what it looks like. It's Christmas tree in shape, and of course you work it between the teeth to clean thoroughly between the teeth. Outside, a little more difficult on the inside, but you can bend it if you need to get to the inside. So this can be helpful. Again, some people like this and favor it. Another version of the Proxybrush is one that is not Christmas tree shaped, but is straight. It may fit in smaller areas between the teeth, perhaps some areas like this. All these are sold in drugstores. Let me tell you next what I use personally to clean between my teeth, and I use them every night. This, to me, is perhaps the most valuable tool in cleaning between your teeth. I like it even better than floss. Floss is great. I like this even better. It's called a Softpik Advanced. I love these. I work them between my teeth every day, very thoroughly on the outside and on the inside. They're great. Now they do bend, so when it gets bent, just throw it away and take another one. These are sold at Walgreens. They're not always available everywhere, but I know Walgreens has them. If you have difficulty doing the inside, the outside is really the most important thing. But when you do the outside, make sure and go all the way through to the inside so it's cleaning very, very thoroughly. And this is probably what I use the most and recommend to virtually all of my patients. The doctor picks are very, very good because some places the Softpik Advanced may not fit, and this will fit. It has two ends, a brush end and a pointed end. I use the brush end, and I do use these periodically also, sometimes for a change of pace, sometimes for areas that are more difficult to reach with the other tools. And again, all the way between the teeth, so you get the inside and the outside. If the teeth are very tight, you may want to use the pointed end, kind of like a toothpick, to clean between there. This is certainly one of the most important replacements or additions to dental floss. I use this every night to flush out food particles and stimulate my gum tissue between the teeth. I started out on low pressure when I first got it and gradually worked my way up to the highest pressure. It's very effective. You'd be amazed at how many food particles you see coming out when you're using this that you don't even know are there. I use it every night before I go to bed, and then I use it in the morning after I brush my teeth. So a water flosser, in this case the Waterpik, is an extremely valuable addition to your home care program, and I think it's more important actually even than floss, in addition to some of the other things that we talked about to use between the teeth. When you use the Waterpik, at least this is the way I use it, and I think it's the best way, I keep my head over the sink and have the nozzle directed along the gum line where the tooth and the gum meet. I use it on the outside and I use it on the inside. Again, I'm up to the highest pressure. So they also come with various other tips. I don't really use those. They have other purposes, maybe specifically for massage or for gentler water pressure. But I use the standard Waterpik. I started out on the lowest and I've gradually worked up to the highest by using it a long time. So use it horizontally, not vertically, along the gum line, outside, inside, bottom, and top. You're going to get a lot of water spray, so keep your head over the sink. So remember, the most important thing you can do to save your teeth is to stop gum disease. The most important thing you can do to stop gum disease is to eliminate the bacteria that cause gum disease. And one of the best ways to do that is to clean around your teeth and particularly between your teeth to eliminate those organisms and to stimulate the tissue. Remember, if you have a healthy mouth, you're going to have a chance of having a lot healthier body. Really makes a difference. Have a good day.
Restore your smile and your health with the help of Dr. Nemeth and his associates. Visit drnemeth.com to schedule your appointment today.